I'd like to acknowledge the traditional custodians of the land we are meeting on, the Ngunnawal people. I acknowledge and respect their continuing culture and the contribution they make to the life of this city and this region. I would also like to acknowledge and welcome other Aboriginal and Torres Strait Islander people who may be attending this conference. The last year has been a very busy and very successful year for the Federal AMA. In fact, it's been a very busy and very quick 2 years for me as President. Throughout the last 12 months, your elected representatives and the hard-working staff in the Secretariat in Canberra have delivered significant achievements in policy, advocacy, political influence, professional standards, doctors' health, media profile and public relations. We all worked tirelessly to ensure that health policy and bureaucratic processes were shaped to provide the best possible professional working environments for Australian doctors and the highest quality care for our patients. The unique role of the AMA in health advocacy is what we are looked to for commentary on the breadth and depth of health policy, social policy and the health system. This privileged role is no more evident than on budget night, held a fortnight ago here in Canberra. We were there at the Health Lockup in the Hellenic Club in Woden with all the other associations, societies, colleges, federations, lobbyists and advocates to hear and read the details and entrails of the budget. Both of my phones were off, if only briefly. I assure you the health budget papers are thick. They cover everything, the announcements, and of course the things that are not announced, the hidden detail if you like. So in the lockup, you have about an hour and a half to read the lot, listen to the gloss from the ministers and the department and search through the dross for the things the government might prefer to have unseen or unsaid. You prepare your budget response in that time and then escape the lockup to run off to Parliament House and give the media your verdict. The public health people talk about the public health bits. The hospital people talk about the hospital bits. The various body organ groups talk about the body organ bits. The consumer groups talk about the consumer bits. The rural groups talk about the rural bits, and on it goes. I was delighted for Sarah Brown and Purple House when I saw they got their new Medicare item number for remote renal dialysis. But of course the AMA has to be ready to talk about all the bits of the health system, how they fit together and how the budget will or will not keep it working. That takes a fair bit of work. And budget night is a microcosm of what the AMA does and does well. All year round, year on year, we get asked about everything in the health system and everything that affects the health of individuals and the community. Importantly, we always have the right answers. Thank you, Catherine. It is our collective honour to have this leadership role and we have been very active in it over the past year. Following on from the highlights video we've all just seen, I'd like to run through some of the greatest hits of 2017-2018. Our strong and robust advocacy led to the decision to lift the freeze on Medicare patient rebates. We did not get everything we wanted in the time frame we wanted it to happen, but we got the right result. Sometimes in advocacy you have to take your wins in increments. A win is a win is a win. And hello to all the West Coast Eagles supporters in the audience. A lot of organisations get nothing for their efforts. To be successful in Canberra, you have to learn to take the knocks along with the wins and go back again and again for a better outcome. It is breathtakingly naive to think it works otherwise. And that is what we've done and keep doing. In 2017, the AMA launched its regular Safe Hours audit report, which gave added focus to the emerging issue of doctors' health. To enhance this focus on doctors' health, AMA coordination of doctors' health services continues all around the country with funding support from the Medical Board of Australia. We maintained a strong focus on medical workforce and training places, which resulted in the National Medical Training Advisory Network significantly increasing its workforce modelling work. We secured a number of concessions in the proposed redesign of the Practice Incentive Program, the PIP, as well as a delay in the introduction of the changes. The AMA lobbied at the highest level for a more durable solution to concerns over pathology collection centre rents. We focused on effective compliance and in doing so achieved a fair balance between the interests of GP members and pathologist members. We led the reforms to after-hours GP services through medical deputising services to ensure that these services are better targeted and there is stronger communication between them and a patient's usual GP. We successfully lobbied the ACCC to renew the AMA's existing authorisation that permits GPs to engage in intra-practice price setting. This potentially saves GPs thousands of dollars every year in legal and other compliance costs. We ensured there was a proportionate response from the government in response to concerns over the security of Medicare card numbers. This avoided more draconian proposals that would have added to the compliance burden on practices and added a barrier to care for many patients. We fundamentally altered the direction of the medical indemnity insurance review. This is possibly the greatest example of Minister Greg Hunt's engagement with the portfolio. Some, not all, ministers have the intellect to grasp the detail of a complex policy issue. You had not only that, but the wisdom to trust the advice that you were being given. Indeed, we raised the importance of medical indemnity to medical practice at the highest level, I hope, in helping to ensure the review was not used as a blunt savings exercise, recognising the policy triumph that the indemnity rescue package was, not only for the AMA and the Howard government, but for patients by ensuring a safe and secure system to protect independent medical practice. The AMA campaigned on the issue of doctors' health and the need for COAG to change mandatory reporting laws, heavily promoting the WA model. I hope that we finally achieved a good outcome at the most recent COAG Health Council, at which I had the rare honour of addressing health ministers. But it's time for them to act. Healthier doctors provide even better care. Let us be able to take our own advice and be able to seek help early. It's a great privilege being a doctor. The community affords you a status, and usually for activity discourages innovation and is inadequate in addressing the demands placed by an ageing population. We prosecuted the case for vastly improved private health insurance products through membership of the Private Health Ministerial Advisory Committee, through my annual National Press Club address, an appearance before a Senate Select Committee, and regular and ongoing media and advocacy. This work was complemented by the launch of the AMA Private Health Insurance Report Card. We successfully lobbied for a fundamental change in the direction of the Anaesthesia Clinical Committee of the MBS Review. The Australian Society of Anaesthetists were grateful for our assistance and leadership. Many other colleges, associations and societies have worked out that partnership with, rather than competing with the AMA, is the smartest way to get results. We launched a new AMA fees list with all the associated benefits of mobility and regular updates. We saw a number of our aged care policy recommendations included in a number of government reviews. We lobbied against what could easily have been an ill-thought-out UK-style revalidation proposal. Our work resulted in a vastly improved professional performance framework based around enhanced continuing professional development. The AMA provided strong leadership right across the busy public health landscape over the past year. With the support of the Minister for Indigenous Health, Ken Wyatt, we launched the AMA Indigenous Health Report Card, which this year focused on ear health and specifically chronic otitis media. Yesterday, the Federal Council endorsed the Uluru Statement from the Heart, acknowledging that recognition is another key social determinant of health for Aboriginal and Torres Strait Islander Australians. We released an updated AMA policy statement on obesity, a product of a policy session from last year's National Conference. I think it's inevitable we will inevitably see a tax on sugar-sweetened beverages similar to those recently introduced in Britain and Ireland. In fact, it's so simple, so easy and so obvious, I worry that it will be seen by a future government as a silver bullet to what is a much more complex health and social policy issue. We launched the AMA position statement on an Australian Centre for Disease Control, which was welcomed by experts in communicable diseases. We released the AMA position statement on female genital mutilation, providing a platform for the AMA to engage in advocacy on preventing that abominable practice. We released the AMA position statement on infant feeding and maternal health, seeking to find that common sense balance between developing measures to increase breastfeeding rates at 3 months, 6 months and 12 months, while calling for a bit more understanding and compassion for those mothers who, for whatever reason, cannot nourish their baby that way. We released the progressive and widely supported AMA position statement on harmful substance use dependence and behavioural addiction, or addiction for short. And no, I do not have a deeply held personal vendetta against pill testing at raves, or cannabis, or e-cigarettes. Like everything else, it is the Federal Council's policy, and I'm sorry to those advocates for change, but it's based on the available scientific evidence. We successfully lobbied against the proposal to drug test welfare recipients. This included a strongly worded submission to a parliamentary inquiry on the proposal, which resulted in defeat of the proposed measure in the Parliament. We hear the Turnbull government will again try to reintroduce this legislation. The AMA will again work to defeat it. We released the AMA position statement on firearms, generating considerable media coverage and interest in Australia and overseas, enabling me to achieve a lifelong ambition of being on the radio in Texas. It is important that Australia maintains its tough approach on gun control. It is vital that the AMA remains at the forefront on this call. We conducted ongoing and prominent advocacy for the health and wellbeing of asylum seekers and refugees. This included a meeting with the then Minister for Immigration and Border Protection, Peter Dutton, and lobbying on behalf of individual patients behind the scenes. Our advocacy on behalf of these individuals and cooperation with the Australian Council for International Development continues. I acknowledge the announcement of a new Chief Medical Officer of the Department of Home Affairs yesterday. We promoted the benefits of immunisation to individuals and the broader community. Our advocacy has contributed to an increase in vaccination rates. We push closer to being able to celebrate 95% rates in children. We've been prominent on maternal vaccination and seek greater penetration rates more broadly with adult vaccination. I wrote to Minister Hunt calling for the establishment of a no-fault compensation scheme for that very small minority of individuals injured by vaccine administration. It is essential that, in the absence of such a scheme, that the National Disability Insurance Scheme works for these patients. It is essential to the community's ongoing support of population-wide immunisation programs. We provided strong advocacy on climate change and health, among a broader suite of commentary on environmental issues. We consistently advocated for better women's health services and released a first ever statement on men's health. We have released new position statements on mental health, road safety, nutrition, organ donation and transplantation, bloodborne viruses and rural workforce. We promoted our carefully constructed position statement on euthanasia and physician-assisted suicide during consideration of legislation in Tasmania, Victoria, New South Wales and Western Australia. That advocacy was not universally popular. Our position statement acknowledges the diversity of opinion within the profession. It also acknowledges the need to consider the possible negative impact on the rest of the health system. Like the American Medical Association, the other AMA, we stand firmly against euthanasia and physician-assisted suicide, while acknowledging that legislation has been introduced in some states and that thoughtful, morally admirable individuals hold diverging yet equally deeply held and well-considered perspectives on the issue. We must look at the European experience, at the rejection of euthanasia and physician-assisted suicide by all Scandinavian countries and by Britain. We must heed the cautionary tale of the Benelux countries with the ever-expanding reach of their assisted suicide laws. There is no such thing as critical neutrality. You have to stand for something and be heard. Thus, we led the medical community by being the first to release a position statement on marriage equality and advocated for the legislative change that eventuated in late 2017. I had face-to-face meetings with Prime Minister Malcolm Turnbull, Opposition Leader Bill Shorten, Health Minister Greg Hunt, Shadow Health Minister Catherine King, Greens Leader Dr Richard Di Natale, and a host of ministers and shadow ministers. We organised lunch briefings with backbenchers from all parties to promote AMA policies. In July 2017, our advocacy was publicly recognised when the Governance Institute rated the AMA as the most ethical and the most successful lobby group in Australia. I met regularly with stakeholders across the health sector, including the colleges, associations and societies, other health professional groups and consumer groups. The highlight of the 2017 International Calendar was the annual General Assembly of the World Medical Association. Outcomes from that meeting included high-level discussions on end-of-life care, climate change and environmental health, numerous other global, social and ethical issues, and seeing the inclusion of doctors' health as a core issue in both medical ethics and professionalism. I get goosebumps when I read aloud the Declaration of Geneva like we did this morning. It is a source of immense personal pride that I was intimately involved with its latest editorial revision, only the fifth since 1948. But our focus remained at home, and your AMA was very active in promoting our mission, leading Australia's doctors, promoting Australia's health. We had great successes. We earned and maintained the respect of our politicians, the bureaucracy and the whole health sector. We won the support of the public as we have fought for a better health system for all Australians. I was elected president in the middle of an election campaign. The combination of a knife-edge result, a one-seat majority, and the bruises felt by the Turnbull government after the Medi scare made it a difficult environment to champion serious health reform. A health system that pays a GP more to inject Botox than visit a residential aged care facility is broken. A system that regularly has acute mental health patients languishing for hours or days in emergency departments is broken. An aged care system and a wider society that tolerates abuse of the elderly, that if it was visited on children, would see individuals jailed and corporations penalised, is broken. But reform is and has to be incremental. We have to engage issue by issue on things like the MBS reviews, the introduction of the My Health Record, and the workings of the Private Health Ministerial Advisory Committee. My successor will learn quickly that delivering a just, morally or intellectually correct argument does not mean things just happen as if by magic. As the end of my term as president of this amazing organisation draws near, just 48 hours away, I look back fondly and with pride at the events, incidents, agreements, arguments, successes and adventures that are part and parcel of the job, for those who have gone before me and for those who will follow. Being AMA president puts you at the centre of health policy and politics in the nation's capital, more so than almost any other role in advocacy and lobbying in this country. Being a state AMA president is demanding and significant. In my view, it is a prerequisite to step up to a leadership role in the federal AMA. The federal presidency takes things to a whole new level. The number of policy issues to grapple with is multiplied many times. So too the number of meetings. You must deal personally, often face-to-face, with ministers, shadow ministers, MPs and senators from across the political spectrum, plus their staff and their departments and the bureaucrats. You might not get much notice. It might be very early or very late. You're on a first-name basis with the Prime Minister and the Opposition Leader. Yes, the AMA President is very much in the game. Prime Minister Turnbull's decision to move Greg Hunt into the health portfolio was clever and inspired. I was driving through Harvey when the PM telephoned me. Beef country, dairy country. I wanted a GP locum there. The Prime Minister asked me who I wanted as Health Minister. I told the Prime Minister it's not my job to nominate the Health Minister, but I simply requested someone who had the seniority and the authority to fight for Australians and their healthcare in Cabinet and ERC. The new Minister wanted to work with us from minute one. I was watching the telecast down in Dunsborough. My wife and children were still asleep, but my telephone rang literally as the PM's press conference was finishing. That relationship has grown, matured and endured, delivering for AMA members and all Australians. I thank Greg Hunt for his deep engagement and his willingness to listen and learn. I hope that this will continue with my successor. In closing, I must say that it has been a huge honour and privilege to serve the AMA and the medical profession as Federal President. It is demanding, challenging, rewarding and life-changing. The issues, the experiences, the depth and breadth of policy and ideas and the interface with our political leaders in the Parliament are unique to this job. The responsibility is immense. The payback is the knowledge that you can achieve great things for the AMA membership, the whole medical profession, and most importantly, the community and the patients in our care. I didn't need an alarm clock the whole 2 years of my presidency. The dawn chorus was the Australian media. Rarely a morning went by without a call from a breakfast news program. Calls to Perth from East Coast media during daylight saving were not necessarily a particular highlight. It has carried a personal cost. My blood pressure is higher. I've been away from family and friends often, sometimes for long periods of time. Social media is a very effective tool, but it offers greatest encouragement to the noisiest, not necessarily those with something important or intelligent to say. The haters will hate, and neither the critics, nor in fairness the fans, seem to understand the hundreds of hours involving many different people of thought, research, endeavour and debate that go into our policies and position statements. I've enjoyed great support from many people. I've spent hundreds of hours on aeroplanes. I cannot end my time without praising Qantas, that great Australian company that's been looking after Australians for 98 years, and for me over 2 years in the presidency on about exactly 98 individual trips. I recently did the count. I've been to every state and territory at least twice. I've represented the AMA in Thailand, Japan, Taiwan, the United States, New Zealand, Britain, Latvia and Zambia, plus 15 trips to Sydney, 28 trips to Melbourne, and now my 36th and final trip to Canberra as President. It has been tough, but it has also had many, many benefits on a personal and professional front. I thank you all for your support, confidence and friendship. The AMA is a wonderful organisation that does many good things for many people. I congratulate Dr Dilip Depilia and Dr Julian Raitt on their recent elections to state presidency. There is much healing to be done in the great states of Queensland and Victoria, many members to attract back to the cause. From time to time I've been praised by non-members for the job that I've done, usually accompanied by a story of a past grievance against the AMA. It is a broad church. No doctor agrees with everything the AMA president says. Even I don't agree with everything I say. Good time to have a drink of water. But I would encourage all doctors to think about what we achieve on behalf of all of them, member and non-member, every day of the year. Through our relationships with and advocacy to AHPRA and the Medical Board, the medical indemnity industry, government and the bureaucracy. Fighting for their clinical independence, for public health, for the health of Australia's First Peoples, for evidence-based prevention measures, and in their name for those without a voice. I would like to give special thanks to some key people for helping me get the job done. My Vice President, Tony Bartoni, especially for helping with the heavy media workload. If the presidency was decided purely on loyalty and decency this Sunday, we could put the pencils away now. Thank you to my obstetrician and gynaecologist colleagues in Perth, particularly Dr Richard Murphy. Nearly every week I had to telephone someone to announce my next trip away. The extent to which my colleagues, my staff, and indeed my patients have bought into what I've been trying to achieve over 4 years as State President and then Federal President has been genuinely humbling. I remember my late colleague Dr Glenn Lewis, who, until taken far too young by heart disease, was a wonderful supporter. Thank you to the State and Territory AMAs for their teamwork. I would like to make special mention of Dr Omar Khorshid, Dr Andrew Miller, Dr David Mountain, Mr Paul Boyatzis and everyone at AMA WA for their support, collegiality and friendship over the past 7 years, or is it 11 years? Who's counting? To the AMA board, so calmly and professionally chaired by Dr Ian Dunlop, I say thank you. To the Federal Council, led with such humility, panache, humour and class by Dr Bev Robotham, I say thank you. To Lauren McDougall, my often barefooted, occasionally sharp-tongued and always capable executive assistant, I say thank you. Thank you to Anne Trimmer for your enduring support and excellence and for the huge reform you delivered in your 5 years as Secretary-General. I wish you the best in the next phase of your brilliant career and look forward to a seamless handover to your successor, Dr Michael Shaper. Thank you to the highly talented and very hard-working Secretariat. Even if you occasionally don't think all these doctors are worth it, you know that your contribution to a better and healthier Australia is. Thank you to the directors in the Secretariat, to Simon Tatz, who only recently left our public health section, and Kate Stockhausen for the fabulous 6 years we spent together on ethics. To Luke Toy, Warwick Huff and John Flannery, I couldn't wish for 3 better blokes or more capable professionals to have guided me through often stormy waters. The credibility you 3 men have within the government and the bureaucracy in Canberra is substantial. It is richly deserved. I thank you. So to the National Conference and the membership, I think that I've delivered on what I came to do, what I said that I would do 2 years ago. We have a better relationship with government. The AMA's job is not to curry favour with those on the Treasury benches, but nor do we necessarily do the bidding of the opposition or the crossbench. We are ferociously, furiously, and I'm sure the senior politicians in the room will agree, often infuriatingly independent. We are getting closer to a better private health insurance system. You've all heard the ideologues who will tell you there's a better way. They are wrong, and the private hospital system must remain a key part of universal healthcare in Australia. In Sweden, citizens buy insurance to move up the public elective surgery waiting list. In Britain, waiting lists extend to many years. Around 90% of Canadians live within an hour's drive of the US border, and trips across it for private healthcare are commonplace. Even the most modestly talented student of history knows how the elites get looked after in Russia and China. No thanks. In Australia, the elites make up 70% of those having surgery. The critics of private medicine are either deluded or willfully misleading. Failure to get PHI reform right is not an option. I care about Aboriginal and Torres Strait Islander Australians. I promise my Indigenous sisters and brothers that my commitment to them doesn't end this Sunday. I care about rural Australia, and I promise the doctors in training action on workforce. Australia doesn't need more medical schools. Australia doesn't need more unimaginative, lazy and morally dubious mass migration programs, importing hundreds of doctors to just end up in our capital cities. The changes we sought to bonding will literally change people's lives. There are the beginnings of real reform. Now it's the time for the states, the territories and the colleges to act. The fact that workforce reform formed the centrepiece of the health budget was no accident. Finally, to my wife Mariam, my daughter Kira and my son, I might get emotional, and my son Patrick for letting me do this job, spending so much time away from home, missing netball, missing football, missing homework, missing dinner. I know it hasn't been easy, but I hope that the 3 of you and the rest of my family, my mum and dad, Richard and Brad, are proud of what I've achieved. I've done all of this for the little families like ours around Australia who do not have the privilege and therefore the responsibility that doctors have to speak out on behalf of those without a voice, the sick, the aged, the frail, the weak, the poor, the drug-addled, the mentally ill, the unemployed, the vulnerable, the dying. And to the family that is the AMA, I know that and I hope that you think that I've served you well. Thank you.